Now let's see pronouns of stage 3 of labor. So let's review. We have 4 stages of labor. We have stage 1, which is the latent phase and the active phase of labor, which basically is effacement and dilation of the cervix to 10 centimeters. Then we have stage 2, which is the delivery of the baby. We have stage 3, which is the expulsion of the placenta. And we have stage 4, which is not a truly stage, but is a 1 to 2 hour period while we are monitoring the mother. So stage 3, which is the expulsion of the placenta. Stage 3 starts at the end of stage 2. So after the baby is born, then the next thing is expulsion of the placenta, and normally the duration of this is 30 minutes. So prolonged stage 3 is while the time for the expulsion of the placenta has been longer than 30 minutes. So more than 30 minutes for the expulsion of the placenta. This is considered prolonged stage 3 of labor, and the causes of this could be because of the quality of the contraction. So if we have a contractions that are not too frequent, so decrease in frequency or decrease in power, or the tone, the pressure of the contraction, or decrease in the duration of the contraction. These are not good contractions, but so if this is the case, we can give IV oxytocin to try to increase the contraction force. But if this is not the case, or if the reason because the patient has not been able to expulse the placenta is because of abnormal implantation of the placenta, as it is the case of placenta accreta or percreta, which we are going to review these terms in the next video. This patient needs first manually removal of the placenta, and if this does not work, then hysterectomy. So prolonged stage 3 is when the duration to expulse the placenta has been more than 30 minutes since the delivery of the baby. This is normally because of bad quality or not good quality of the contractions. This could be because of frequency, power, or the duration of the contractions. Then what we should do is to give IV oxytocin. If this is not working, we should suspect that this is an abnormal implantation of the placenta, as could be placenta accreta or percreta. And so we manually need to remove like all the pieces of the placenta. But if this still has not been able to end in the expulsion of the placenta, then we need to do an hysterectomy. And sometimes, as we will review in the next video, when we have this type of abnormal placenta implantation, placenta accreta, percreta, all that, sometimes we does not do manual removal, or we skip this step, because if the patient is bleeding a lot, we does not have time to try to remove the pieces of the placenta manually, and so we end up going directly to hysterectomy. So basically, prolonged stage 3 is just that the time to expulse the placenta has been more than 30 minutes after the delivery of the baby.